Welcome my friends, I'm Bob Schrupp, physical therapist. Today we're going to talk about orthostatic hypotension, or to the lay person, it's that dizziness that you feel when you go from laying down to maybe standing up or even sitting up. When is that a problem? Of course it's a problem immediately if you sit up or stand up and you feel dizzy and you fall. So these are the things we want to prevent. But there's a way that the doctor is going to actually diagnose it. They're going to look at your readings and see if there's a difference between your blood pressure readings. You're going to see if there's a significant difference between laying down and standing up, and if so, they then may deem that you do have orthostatic hypotension. What are things that might cause it? Dehydration, as simple as that. Hardening of the arteries. Certain medications may cause orthostatic hypotension, such as your blood pressure medications or antidepressants. Now normally when you go from laying down to sitting up to standing up, there's compensatory actions that go on, which means that your body is trying to help you deal with the fact that all your blood is going downhill. So normally when I go from sitting to standing, the blood begins to pool in the arteries in the legs, but in reaction to that my heart rate might go up, and also the veins in my legs are going to squeeze tight or vasoconstrict and help push the blood up. If yours aren't doing that, that's when you might start getting that lightheaded feeling. So what we would do normally is put a blood pressure cuff on you and check it with you laying down, check it with you seated, and check it with you standing. Now if the difference between, let's say, when you were laying down, your blood pressure was 140/80, systolic over diastolic. If this drops to 120 and this drops to, actually it doesn't even have to drop, let's say that stays the same, 80, that would be considered orthostatic hypotension, because what is happening is your systolic is dropping by at least 20 points. The other way is, let's say that stays at 140, is fine, but this one drops to 70. A drop of 10 or more in the diastolic would mean that you have orthostatic hypotension. And finally, if your heart rate goes up by more than 15 points, so let's say you're at 80 beats per minute and you stand up and it's 95, that's another indication that you may have orthostatic hypotension. Of course, this is not something you want to mess around with yourself. You want to get this diagnosed by your doctor. But this kind of gives you a general idea what they're looking at and what things they may want to look at to try to help you so this does no longer happen to you. Of course, if you are feeling this, what you want to do is when you get up is you want to sit on the edge of the bed for a while. And when you do stand up, make sure you stay close to the bed and stand there for a while before you go off and do your things to make sure the dizziness has cleared. Good luck to you, and I hope you want to subscribe to me. We're going to provide information on physical therapy and fitness and things that I know something about. Of course, we're going to throw a little business in there once in a while too. Thanks.